If you have sciatica, it can usually, will usually feel like a pain running down the back of the leg, sometimes at the side or just right down the back of the leg. Often it will be a shooting, kind of lancing type of pain, or it could just be a very intense ache in the leg as well. Sometimes it's accompanied by other symptoms such as pins and needles or numbness in various parts of the leg or the foot. Occasionally people will feel like it's a pulled hamstring muscle. Sometimes people come in thinking they've actually pulled their hamstring muscle. But there are quite easy ways of telling in clinic and doing little tests to see whether that is the case or whether in fact they've actually got sciatica. What's actually happening with sciatica is that one of the what's called nerve roots in the lower back that make up the sciatic nerve in the buttock, one of those nerve roots is getting pinched or squashed. And there's various things that can do that squashing and can pinch on that nerve. But by far the most common cause is a slip disc, or we call it a bulging disc. And again, there's various grades of bulging disc. You have protrusions, extrusions, sequestrations, all these sorts of things. But essentially, yes, you talk about a bulging disc, a herniated disc, sometimes they call it, that's pressing on that nerve, and that's what's giving you the pain that's going down into the leg, or even sometimes it will be in the buttock and slightly just into the top of the leg. This is a great question, and people often ask us how long are they going to be in this pain for. The answer to that is that it does vary. However, with the right advice and the kind of right care, even just doing the right things and doing the correct do's and don'ts at home, sciatica will often settle within 6 to 8 weeks with a lot of cases, so even without having to have treatment. Unfortunately though, that is by no means always the case, and it's not uncommon that we see patients in clinic who have been suffering with sciatica for many weeks, months, and in some cases more than that. A year, 18 months is not uncommon, which we've seen. So really my advice is if the sciatica is not resolving within around the 6 week mark, that's when you probably need to start having something done about it, certainly. And even before then, I think the earlier the intervention, the earlier you get the right advice and start to get a bit of treatment, the less likely you're going to be into those situations where you're in for a long haul, and the quicker things are going to resolve. There's no doubt in my mind that the best form of treatment that we have available in our clinics is the IDD therapy. It's the very reason why I brought IDD therapy into our clinics. So for patients with sciatica due to a diagnosed slipped or bulging disc, it definitely would be top of the list, IDD therapy. What we found, and what I found, was that when I graduated as an osteopath several years ago, I was limited in what I could do for patients with actual bulging or slipped discs. So I really did start looking around what was available, and one of the things I found at the time was IDD therapy. We were I think we were number 3 in the UK to get IDD therapy installed in our clinics, and now there's over 40 clinics in the UK that are offering IDD therapy. What IDD therapy does, it uses very precise, controlled computer pulling forces to target and gently distract segments within the spine where the damaged disc is, where the pinched nerve is, and that will encourage the disc to heal and take the pressure off the nerve that's being pinched. So certainly if I saw, or one of my colleagues saw, a patient in clinic and their sciatica was due to a slipped or bulging disc, and that's what we saw on the MRI scan, then certainly IDD therapy would be probably the number one thing, in my opinion, that we should be offering that patient. We've been involved with IDD therapy right at its introduction into the UK, and we are one of the most experienced centres that are offering IDD therapy. Probably similar to the advice I gave for low back pain, really, and I think the number one tip is to avoid slouching postures. When you sit or when you stand, let's say, with a slightly curved, rounded back, the actual pressure on the discs themselves increases by around 3 times. The strange thing is that you may not feel that because there's not many nerve endings in the disc itself. And the other thing that happens is when you lean forward, the actual space around the nerve increases, but the pressure on the disc also increases. So you're accumulating damage in the disc, which you may then end up feeling later. So Be careful of slouchy, slumpy sofas. Try and have a cushion in the lower back when you're sitting. The other thing that's very important is that when you're lifting, even if the object's light, you want to make sure you've got that neutral posture in the lower back. So especially don't slouch, and especially don't slouch and twist at the same time. Keep the objects in front of you, keep it square on, get close to the objects, keep that neutral little curve in the lower back, keep the core muscles nice and tight, and as you lift, push with the legs, driving through the heels.
Thank you for watching this video all the way through. Please subscribe to our channel by clicking on the red subscribe button. For specific conditions and self-help tips, please search our playlist. We'd also be really grateful if you could share any of the videos you've seen. If you want more information, please click on the Find Out More button and you'll be directed to our website.